Necrosis versus the apoptosis. So firstly, looking at necrosis, the mechanism is that it is enzymatic and it's an ischemic process. Whereas in case of the apoptosis, it is known as the genetically programmed cell death. Now looking at necrosis, it is a passive process, whereas in case of apoptosis, A for active process. Next, looking at if it is physiologic or pathologic, the necrosis is pathologic, the apoptosis is physiologic as well as pathologic. The cell site, the necrosis is enlarged, that is, there is a presence of swelling. Whereas in case of apoptosis, the cell size is reduced, and this may be due to the shrinkage. Next, looking at necrosis, the cells affected are a group of cells, whereas in case of the apoptosis, it is a single cell death. Next, looking at nucleus, the necrosis, there is presence of pycnosis leading to karyoexis leading to karyolysis. Whereas in case of apoptosis, there is fragmentation into the nucleosome size fragments. Then moving on to the plasma membrane. Here in case of the necrosis, it is disturbed, whereas in case of the apoptosis, it is intact. Next, the cellular contents. Cellular contents, it contains the enzymatic digestion. This is in case of the necrosis. And then looking at the apoptosis, it is intact. Then inflammation, in case of necrosis, there is presence of inflammation. In case of apoptosis, there is no inflammation. Looking at markers, in case of necrosis, there are no markers. In case of apoptosis, A for apoptosis, there is presence of the annexin. Then looking at the page, there is a DNA electrophoresis. So here there is a smear pattern which is seen in the necrosis, and the step ladder seen in the apoptosis.